RG blog, January 8th, 2021 at 12:20 p.m. Hi, everybody. My name is Rob Gordon. I have been off social media for about 6 months now, and I thought I would tell my friends here why. I've had a really, really horrible experience with the people who are supposed to be my mental health services provider, Family Health Centers of San Diego. They've got some real dishonest players there, and I believe fraudulent activity and even criminal activity. And I'm going to try to tell the story, a really, really short version here, but in the coming months and maybe even years, I'm going to be telling the whole story. This is one of the worst things that's happened in my life. I've looked back on it, and I can say it's one of the three most damaging things that happened in my life. And it started with me being very honest and somebody else telling a small lie. And it escalated into a horrible situation that is now in the courts. And I have lost one of my really basic American rights, something that most people wouldn't think is important to me, but I'm no longer an equal American like the way you guys are. So let me give you a really quick rundown of what happened. And I posted this. I think one of my last posts was on Twitter that I had lost my mental health services. What happened about 3 years ago, I was correctly diagnosed and successfully treated for ADHD by a psychiatrist named Dr. Edward Urbe at Family Healthcare Centers of San Diego. He was a careful and thoughtful psychiatrist. He didn't come up with that diagnosis loosely, and it was the correct diagnosis. I didn't know much about it then. It's a part of youth culture, and I was being diagnosed much later in life. But I fit the DSM-5 criteria almost perfectly. So he gave me the medications. As most of you know, they're stimulants in low doses to treat this attention condition, and the effects were nothing short of miraculous. I learned what normal human attention is for the first time in my life. Some people compare it to putting on glasses for the first time. There's really no good metaphor you can come up with. You just go, oh, so that's what it is. I think if you've seen some of those videos of people who get implants in their ears and hear for the first time, I don't know if it's that dramatic, but it is really, really life-changing. And you only get that awareness for like 1 or 2 days, but everybody that gets that experience, it's life-changing. So now, as a result of these medications, or what happened as a result of these medications, everything in my life started getting better. Relationships, they weren't a huge problem before. Relationships got better. Business absolutely got better. My income went up. And then over time with Dr. Urbe, we started scheduling fewer appointments, and I think I was only meeting with him once every 3 months. Because everything was working. So I called that a low-cost, highly effective mental health treatment. It's what you want. It worked. Everything was fine. That was before I met two characters at Family Healthcare Centers of San Diego. Derek Aragon, one of their psychiatrists, I believe new or young, and the guy who describes himself as their leader. His name is Joseph Pulveda. So real quickly, after what happened was, at my last appointment with Dr. Urbe, we had been on this every 3 month schedule, and suddenly, without explaining it, he changed it to monthly. And I saw he was a really, really honest guy, but I could tell something was wrong. His explanation didn't really make any sense. He said something about COVID, but you could tell it just didn't make sense. They were doing a monthly now. I've since surmised that it had a lot more to do with money and billing. Family Healthcare Centers probably was in some financial situation, needed more money. I can even put up with that to a certain point, but what happened next is just unconscionable. So they changed my appointments to monthly. It was going to be 3 months out with the prescription automatically renewed. And so I had an appointment in their alert system, and they sent it to me that I was supposed to have an appointment. But what usually happens when the month comes around is you get a reminder, and that reminder never happened. And as you might know, adults with ADHD aren't the best at following up on things. So my medications were almost running out, but I had a little extra. So I didn't call until about a week after my medications had prescribed. As hey, Dr. Irby, what's going on? Did you want to meet this month? I just thought he had gone back to the 3-month schedule. He never got back to me. Eventually, I got a call from Family Healthcare Centers, one of the administrators there. Dixie Clapelon, I don't know if I have that last name right. And she said they're working on it. I was surprised they didn't tell me. I thought that even at that point, I thought it should have been taken more seriously. But she said, okay, well, we'll get another appointment with you. And then she made something up. I don't recall the exact amount of time, but it was way off into the future. It was something like, I think 3 months. It was more than 2 months. And I was just kind of shocked that was even, be considered. Okay, the story's going to get too long if I go beyond this, but eventually, I negotiated that down to, I think, a couple weeks, I think. Then so my meds are running out. My meds had run out, and I was starting to go in withdrawal without help from these medications, medically unsupervised withdrawal. Then they introduced me or set me up with an appointment with woman, Dr. Aragon. The session was really weird. The first thing I noticed, she was really angry with me, and I didn't know why, because I was relieved. I had been gone through withdrawal and about a month without medications. I was agitated. People with ADHD know the symptoms of withdrawal. You're agitated all the time. And eventually it gets a little bit better. But she was angry at me, and I couldn't understand why. She went through a bunch of questions, didn't care about the answer. Then she got to the point, and it was her last question. That's real suspicious to me. Her very last question was, have you ever used cannabis at any time in the past, even once, in any amount, even once? The question was asked with zero leeway. Any kind of cannabis, even a little bit? And I don't use the stuff much. I have an old college buddy. We'll use it sometimes. I go over. I say maybe once every month, once every 2 weeks. Maybe sometimes there, but it's not just a big thing with me. I rarely drink it. I rarely use cannabis. It's legal in this state. So I said, yeah. She goes, that was her. She jumped on me. She goes, all right, you are now immediately subjected to random drug tests. You've already signed an approval. We have the right to this. She was lying. I did sign an agreement. I'll show it later. And it was a reasonable agreement, controlled substance agreement, but it said nothing about people coming over my house for random drug tests. Then she says, furthermore, you will be subject to a whole battery of psychological tests. I said, well, what tests? She couldn't. I know a bit about ADHD. There is no standard test for it. She couldn't name a single test. The manufacturer, the publisher, anything. So right away, this is shocking. Well, as you can imagine, the conversation went downhill from there. I'm trying to think what else she asked. Oh, what I want to emphasize is she couched everything in terms of orders. He says, I am ordering you to quit cannabis immediately. She said both active and passive. So you understand, you are being ordered. Some people react to that. Some of my friends from the AB5 fight, I hope, are listening to this. You're fiercely independent people, and you don't react well to orders. I'm surprised they did it that way. She seemed really into it. Okay, I'm not going to dwell on that. The next meeting set up 2 weeks later. That blew up, obviously. 2 weeks later was with a guy, Joe Sepulveda. It immediately got off on the wrong foot. I don't know if you ever have where your instincts just, you don't want to be even talking to the person. I can't remember what his first opening remark was, but something about me coming to him to ask for help. It's real degrading, whatever he said. And he pretended he didn't know about any of the background, which is just implausible. Then he just went on. He really badmouthed my previous provider. He wanted to convince me that my ADHD diagnosis was inappropriate somehow. He said things like, are you aware that Dr. Irby did not order the appropriate tests for you? Dr. Irby was just excellent. I mean, he nailed it. And I don't know what tests this guy was talking about. So I again asked him, and this time a lot stronger. So what tests? Who was the public? He would not answer. He didn't know. I don't think he knew at the time. I'm sure he could go to Wikipedia or something, whip some up, but I really don't think he knew at the time. So I pressed him on that, and the best he could come up with is, whatever we decide, it will be age appropriate. Well, this conversation was just going downhill and downhill. Um, a couple other things are real big disconnects. He said, one thing really upsetting. This is what really got me. He says, well, do you know, I had an unusual medication regimen. I took Adderall 4 days a week and Ritalin, generics for both, 2 days a week. The reason for that, I hate to say it on a video, but it was motility issues, and that broke things up, and it worked for me. And it also helped with tolerance. Because he said, because I had these, are you aware that the agencies that regulate controlled substances have flagged you, and you've been flagged in their database as possibly, he kind of implied that I was getting double doses, and I even thought he was implying that Dr. Urbe and I had somehow gotten together and done some scam. He didn't, he's a real Weasley mouth guy. He didn't come out and say that directly. So I freaked out when he said that. What agency? Who did that? What'd they say? He backed down immediately. He said something like, "Oh, okay, then you explained it. It sounds. Don't worry about it." Well, I didn't worry about it. The agency is called Cures. I'll tell you more what happened then. He was lying, of course. But that was it. The conversation went downhill from there. What happened next was the way the meeting ended contentiously. I said, this is crap. He what I had asked for was after the psychiatrist Aragon, I just wanted out, but I thought I should get two more months of medications, and if they wanted medication monitoring, talking to a psychiatrist. He absolutely, my way or the highway, everything. He expected unquestioned obedience. So at the end, I said, I could complain to the medical board or something. He said, go right ahead. I'm on the board of advisors. And he just smirked at me into the phone. I don't remember who hung up. Could have been him or could have been me. If you're still listening, the story gets worse. I might do this video in 2 parts. But from there, everything went downhill. I'm going to break up this video because I think I'm going to have to take a breather and tell you the rest. But again, one of the most dishonest things I've ever come across in my life. I'll finish the story in a second.